Thank you. Welcome. My task is to say thank you, echo the thanks that have already been shared with you. We'd like to thank the federal government, the provincial government, and the county level of government for their levels of funding which have enabled this project to go ahead. I'd like to thank the architect for following our wishes and incorporating them into his design. I'd like to thank the contractor for doing such a good and timely job. Sorry, I should mention the architect is Jordan Cook and the principal contractor is Loring Construction. Personally, I should thank Andrew for overall management, but certainly Kevin Churchill for his quiet management, who actually helped get the job up and going and the funding secured. Harriet Nagel attended to all the details as was her forte and helped us bring this project forward. Our community partners, West Lambton Health Centre, Rapids Health Centre, and CMHA housed some of our programs as we obviously were constrained by the construction process. So it's been pointed out that this is actually 21 years to the day that we opened the other part, and I was here on that day. I think Jim Philbster was here on that day. I suppose Kathy Dobson was here on that day, probably.
She was really young.
Yeah. It's her first gig. Dick Kirkland probably wasn't far away, but anyway. So I do remember the minister. The minister actually came and gave us a few minutes and opened it. And I was the last person out of the door behind her, and her words were, "Where is my lectern?" So I'm the only person left in the building, so I go scurrying back in and find her a lectern and bring it out so she can make her presentation. So thank you for whoever remembered to put this here. So we stood here 21 years ago. Who knows? And then 21 years in the future seems like an immense amount of time. Looking back, it doesn't seem such a long period of time for some reason. It's certainly been a busy period of time. We've had our challenges. We've had a major meningococcal outbreak. We had Walkerton, which affected all of our water programs. We've had West Nile virus coming through the county in the early 90s. We've had SARS. We had pandemic influenza, all of which caused a great deal of reflection at various levels of government, and certainly here, on how public health programs should be resourced and funded, as we need the capacity to rise and deal with these challenges as they present to us. So I think those do provide a justification for the expenditures here today, which you see expressed so well. Times change, of course, as you go forward. Who would think that brown paint is back in vogue? But anyway, it changes our Baskin-Robbins entrance. You may have noticed that. Anyway, times change, our programs change. We had no health promotion officers when I first came here. We have close to 20 now. We didn't have a health. We traditionally had a public health nursing program looking after doing home visits and looking after high-risk families, but we have a Healthy Babies, Healthy Children program now. So there's been technological change. We didn't have the internet. We have web-based services. Newest kid on the block is our Dine-Site program, which you should go look at the site. It's a fabulous site. We're mostly about programs, and I keep saying that. We're about programs and dealing with the people of Lambton County, but this obviously today is about the building. This inflow of money did have a public health benefit, just in the fact that it happened. It was initially intended from the federal government as a stimulus project, and it did bring money into the community, and prosperity is health. So we're grateful for that. The building does, though, provide an enhanced platform for our programs. It is affirming for us as staff, and that much trust in us and support for us that we can go forward. And that affirmation actually translates into an increased enthusiasm and commitment to our programs. Our staff, let's not say our staff are not committed, they certainly are, but this helps polish things up a little bit, and we'll thank you for that. The actual amount of space was in the handout, and there'll be a test on that in a moment. But so we had 6,700 square feet of used floor space, 6,500 square feet of renovated floor space, 40 new parking places, 50 new modular workstations, and reconfigured areas through the health unit, which help us deliver our programs more efficiently. Improved design equals more efficiency and better programs. The entranceway enables us to greet our clients and bring them into contact with the programs they need more effectively and efficiently. Our clinic space is much more multifunctional, it's much more open, allows us the flexibility we need to ramp up and down to deal with challenges as they may present themselves to us in the future, and also to run our clinics in a safe, efficient manner. The layout actually does allow for different approaches to programming and staffing allotments. But our new dental suite helps provide dental programming and the extra funding that's coming in the Healthy Smiles type program is obviously an enhancement to that. Our new storage is important to us. We can never find anywhere to put anything, but it does make us enable us to store our resources, manage them, and therefore do a better job for you. Our enhanced security helps us provide a better workplace for our, or secure workplace for our predominantly female staff, so that they can do a better job for you, feel safe while they do it. So I don't know what the future holds. Hopefully I'll be here for the next expansion, another 21 years, but if not, I certainly wish everyone well, and thank you for coming today, and thank you for your support for this building.